Hey, just wanted to welcome you to this quick review on red blood cell inclusions. Today we're going to look through the most common inclusions seen in the clinical lab and just brush up on our knowledge of them. At the end of this video, the idea is that we should be able to identify the inclusions accurately. We want to state the inclusion's composition, recall which stain is needed to observe each inclusion, and then list the most common conditions associated with each type. Obviously, these conditions can have multiple types of inclusions, so that's the physician's job or the provider's job to decide exactly what condition the patient has, but our job is to correctly identify them and provide those clues to the provider. So in the clinical lab, inclusions aren't something that we will see all that often compared to other disorders like anesthetiosis or poikilocytosis, all the different abnormal morphologies and such. But obviously red cells, they should just be a nice round shape. We've got an even border, a slight central pallor due to the biconcave shape of the cell. We all know what red blood cells look like. So if there's anything that looks weird about them, specifically if we've got any weird dots or anything to them, we should start thinking about inclusions, which obviously is going to be pathological typically. So we just want to make sure we are aware of them. The most common ones we're viewing in this video are going to be basophilic stippling, Howell-Jolly bodies, Pappenheimer bodies, and Heinz bodies. So let's hop into the review here. With basophilic stippling, these are made up of aggregated rRNA. They'll be seen with a typical blood smear, the right stain, and they're going to look pretty evenly distributed across the cell. A lot of people think it looks like an Easter egg. It's got the bluish black dots just nice and even all over. This is a great picture of it. Patients that may have these include lead poisoning, those with sideroblastic anemias, and maybe a thalassemia anemia as well. With the second inclusion, we've got the Howell-Jolly bodies, and these are made up of nuclear DNA. So the first one, basophilic stippling, was rRNA. Howell-Jolly bodies are nuclear DNA. These also show up on a right stain, just our standard stain. And these look like pretty confined spheres, and typically you'll only see one inclusion per cell, one Howell-Jolly body per cell. Usually these are going to be pitted by the spleen, so if a patient's recently had a splenectomy, you might see these. Also, those with hemolytic anemias or megaloblastic anemias, these can show up in those patients as well. With the third inclusion, this is the Pappenheimer bodies. These are made up of aggregated iron. So these are visible using a Prussian blue stain, not our standard white stain. With these ones, they are typically a bunch of little inclusions hanging out together. They also are kind of bluish purple on this stain. So the difference between these and basophilic stippling, at least in their appearance, is that the basophilic stippling is kind of spread all over. These ones are typically more confined. And obviously there's multiple of them, so we're not looking at a Howell-Jolly body typically. With these, you'll see it in a post-splenectomy patient again, because the spleen typically pits these. And then you can also see it in the sideroblastic anemias, megaloblastic anemias, and hemoglobinopathies. So the last inclusion here is the Heinz bodies. These are precipitated hemoglobin inclusions, and how I like to remember these ones is I think of Heinz ketchup, which is red, and hemoglobin, which gives a red cell its red color. So obviously Heinz bodies are made of hemoglobin. With these ones, we're going to identify them using a supravital stain, and they usually appear as a single small round inclusion, just like Howell-Jolly bodies, but these ones usually hang out on the very edge of cells. Patients might have a G6PD deficiency. That's the enzyme used in the hexose monophosphate shunt of glycolysis. You can also see these in hemoglobinopathies. Obviously, if you're having a problem, creating the hemoglobin or using the hemoglobin, the hemoglobin could precipitate, and then you'll get Heinz bodies. So we've got the four main inclusions. Just a quick review to finish up with identifying them. So we've got the basophilic stippling with the Easter egg look. That's made up of rRNA. We're looking at that with the right stain. We've got the Howell-Jolly bodies with a single aggregate of nuclear DNA. That's also seen with the right stain. We've got the Pappenheimer bodies with the aggregates of iron. These ones are hanging out together, and we identify these with the Prussian blue stain. And lastly, the Heinz bodies are made up of precipitated hemoglobin, and these are seen with this supravital stain on the edge of the cell typically. So pretty easy to identify, make sure you have the correct stain. And it's just obviously super important to recognize these as they are typically pathological. So we want to report those to the provider to help in the diagnosis of the patient. Obviously, there's many more types of inclusions, so be sure to check up on those. But these are the 4 most common ones. So I just want to do a quick review with them. Thanks for watching.